One of the things we do here is fetal surgery. We intervene on unborn babies. We treat conditions even before a baby is born. One of the most commonly performed procedures is a treatment for twin-to-twin transfusion syndrome. The two twins are connected through vessels on the placenta, and there is some blood flow that goes from one twin to the other. Usually they have kind of the same amount of blood, but in some cases, one fetus tends to donate more blood to the other than he receives. Over time, this causes severe anemia. The donor twin will become smaller, fails to grow, and the other one gets too much blood. Typically, there's nothing wrong with either one of the fetuses. It's just that the fact that they're connected that causes the trouble. So ultimately, they really are both at risk of dying before they're even born. To treat that, we go in with minimally invasive methods like keyhole surgery, like laparoscopy, and we block the blood vessels that connect those two babies. That typically will stop twin-to-twin transfusion syndrome and has the chance of saving both babies. We've been doing this for about 21 years. We are not the largest center in the country, but we are the largest and oldest one in the region. Most patients who need this treatment come from outside of Rhode Island. The majority, I would think, are referred to by hospitals in Boston. I remember a couple who found out that their babies had twin-to-twin transfusion syndrome, and they were giving a very, very dire explanation by their obstetrician, saying that things were getting worse and worse, and those fetuses were not going to make it. And mom was insistent and saying, is there really nothing that can be done? The obstetrician told them, well, yeah, but we don't do it here. In fact, there's no hospital in Boston that does that. The only place is in Providence. And so she was referred to us. It's a tricky situation in the sense that we know how to treat it, but we don't always know that the outcome is going to be great. We're working against a lot of odds. Number one, we want to make sure that those babies are still strong enough that they can recover. Number two, we are intervening on a pregnant woman, and there is a definite risk that will cause some trouble. We always make sure that, of course, that the mother is as safe as possible. But of course, we're doing it for the babies. The mother typically goes under general anesthesia, although it can be a regional anesthesia as well. We make a very small incision on the abdomen, and under constant ultrasound guidance, we advance a very tiny telescope, about 2 millimeters in diameter, through the abdominal wall of the mother, into the uterus, into the amniotic cavity, so into the cavity in which one of the two twin fetuses is floating. And then we go down to the placenta and we look at the placenta, find all the blood vessels that connect the two twins. And using a laser, we block each one of those vessels. So we don't touch the blood circulation of either twin. We just go for the connection between the two twins, the tiny vessels. And the vessels are about 1 millimeter in diameter. And those are the largest vessels. So we're talking about very small, almost microsurgery. The telescope allows us to see inside the uterus. So we really look directly at the fetuses. We look at the placenta, the vessels. Ultrasound helps us orient ourselves and confirms what we're looking at. So there are a lot of what ifs in the process. One is that those are twins, and you know that twin gestations are always at a higher risk, especially identical twins. The risk of prematurity, there is a risk of other problems that are unrelated to either this particular condition or even the surgery. We are working against a lot of odds, but when it works, it's incredibly gratifying because obviously that's the only thing that can help them survive. And in this case, everything went very well and the babies did perfectly fine, and she delivered close to term. The last time I saw them was several years ago, beautiful twins who have been doing great since.